The American Medical Association has labeled gun violence in the U.S. a public health crisis. Here's why that matters. In 1993, a study funded by the Centers for Disease Control and Prevention found that having a gun in the house tripled the risk of homicide. That's really bad publicity for guns, so naturally the NRA stepped in.
The National Rifle Association accused the Public Health Agency of lobbying for gun control.
3 years later, Congress cut federal funding for gun violence research.
CDC funding into gun violence research has plummeted 96% since 1996.
Congress actually voted to make it harder for public health experts to conduct research into gun violence.
So not only does the NRA lobby against stricter gun control, it also makes it impossible to study it.
We do research when cars, food, medicine, even toys harm people so that we make them safer. And you know what? Research, science, those are good things. They work.
Yeah, science works. And that's why scientists and doctors are now working against the gun lobby.
We will do our part to help America heal.
Well, in order to help America heal, organizations need to do research. Labeling gun violence a public health crisis could justify that. It's not the first time something's been labeled a public health crisis to initiate research. Earlier this year, Utah lawmakers declared pornography a public health crisis to do just that. Things like Zika and opioids and gun violence make a bit more sense. Even though gun violence takes the lives of 33,000 people a year, some refuse to call it a legitimate public health issue.
Is gun violence a legitimate public health issue?
Absolutely not.
Wait, who's this guy?
Bob Barr, a former Georgia congressman, sits on the board of the NRA.
Got it. Makes sense. While the NRA opposes gun violence research, the former congressman responsible for the initial ban says he regrets it.
No one seems to be doing anything. No one seems to be stepping into the ring. The kids and the innocent people who are being killed deserve our attention.
Firearm-related deaths and motor vehicle accidents both killed roughly 33,000 people in 2013. While gun violence research is at a standstill, CDC research on car accidents has led to multiple safety improvements like better seatbelts and car seats.
They didn't try to get rid of the car. They did it in spite of the car. And that is what we can do with guns.
There's a lot we don't know about guns. We don't know how many guns exist in the US, or why people buy guns, or why Utah lawmakers think porn is a public health crisis. But there is one thing we do know. When it comes to gun violence, ignorance definitely isn't bliss. This is your mic check.